Healthcare delivery patterns have changed rapidly over the years. One of the latest innovations is the use of mobile phones to help patients access medical care efficiently, but at a cheap cost. It is estimated that more than 19 million Ugandans have access to a phone, and this formed the major discussion at the first Health Innovations Conference, which placed emphasis on treatment for HIV and tuberculosis.
We worked with our funders, Janssen and Janssen, who offered us a software called Connect for Life, which we use to offer automated call reminders to our patients, to remind them to take their drugs on time and to remind them to come to the clinic on time.
So we came up with the Zone Web portal. Now the Zone Web portal is a portal where youth can access sexual reproductive health information so that they can make informed decisions.
More than half of Uganda's population is made up of youth, and a good percentage of these interact on smartphones.
So, for example, if I can't get a message to you by internet, can I get a message to you by text? And so we are trying to work around the limitations that we have. Sometimes things surprise us. So when the SIM card registration happened, unfortunately some of our patients weren't registered, and they unfortunately didn't get their calls for a few weeks because they weren't registered.
We're able to regulate pharmaceuticals in Uganda, but for medical devices, the guidelines are a draft. So pretty much the National Drug Authority has to have a mandate to properly test a device for safety and performance before it can be used in a clinical study and before it can be sold on the market.
Other innovations are breastfeeding mechanisms for mothers who don't have enough breast milk and the creation of artificial blood.
Artificial blood without the red part is already there. The red part, which is called hemoglobin, is the most difficult one. So the future might be to create that hemoglobin part, the red part, through genetic engineering, through alteration of hemoglobin from other species.
The Uganda Academy for Health Innovation and Impact, in partnership with Johnson & Johnson, was established with an investment of 24 billion Ugandan shillings for a 5-year period in an effort to bring healthcare services to those that need it most. Andrew Nitwe, NTV, Kampala.